organizers of the Third Soul International Meditation Expo, and also to my dear friend and colleague, Sagwan Sunim, for inviting me. And also thank you, the participants in this expo, for your interest in meditation and for your interest in self-compassion. So in the next hour, I'd like to address the following points. What is self-compassion? The history of compassion in therapy. How does self-compassion work in therapy? 3 ways of integrating self-compassion into therapy, namely through therapist's presence and through the therapeutic relationship and through home practices or treatment interventions. And finally, if we have time, I would like to talk about self-compassion as an antidote to compassion fatigue, and even lead a meditation that you can practice while doing counseling or psychotherapy. So in this talk, I will also focus on the science of self-compassion and psychotherapy, and also how self-compassion can help our clients as well as therapists themselves. Just to introduce myself and how I became interested in self-compassion, I've actually been meditating for a long time, since I was 25 years old. But for the first 20 years, in particular, after I graduated from the university with a doctorate in clinical psychology, with a specialization in anxiety disorders, I personally suffered from debilitating public speaking anxiety. And that is when I would try to speak in front of an audience, sometimes no words would come out of my mouth. Once I was trying to speak to 75 psychotherapists, and I got up to speak and nothing happened. And somebody in the back of the room yelled, "Take a breath," trying to be helpful. So this went on for 20 years. And as an expert, so-called expert in anxiety disorders, I knew everything that the profession knew about how to solve this problem. And I was also practicing mindfulness meditation, and nothing worked until I learned loving kindness meditation, particularly for myself, that until I learned to be very kind to myself, to say kind words to myself, not to make the problem go away, but just because I am a suffering person like all beings. And when I learned to do that, the public speaking anxiety just disappeared. And as a result, I learned a few things. First of all, I learned that my public speaking anxiety was actually not an anxiety disorder, but it was a shame disorder. That behind the anxiety was shame, the fear of being considered incompetent or stupid or fraudulent. You know, here I was trying to talk about mindfulness, and I was so nervous that I could hardly speak. So needless to say, I thought maybe people would consider me fraudulent. I didn't know what I was talking about. So that is shame, the fear of being judged by others in a negative way. So I learned that. But the other thing I learned is that sometimes when we are caught in the grip of intense and disturbing emotions like shame, and also like our patients in psychotherapy, sometimes we simply cannot hold the emotion. We simply cannot make room for the emotion, knowing that it's part of the human experience. First, we need to hold ourselves before we can hold the emotion. And this was when I discovered self-compassion. Sometimes we need to be very kind to ourselves before we can be mindful of our experience. And then after that, in 2008, I met Kristen Neff, who is the pioneering scientist of self-compassion. She created a scale to measure self-compassion that's been used in most of the research over the last 20 years. And she and I then developed an 8-week training program for self-compassion, much like the mindfulness-based stress reduction program. But this one focuses on self-compassion. And since then, this program has been taught to maybe 200,000 people around the world. The curriculum itself is continuing to evolve through the feedback and advice from teachers around the world, including Sogwan Sunim in Korea, who is a wonderful teacher of mindful self-compassion, as well as a teacher trainer. And I've had the great privilege of going to Korea a few times already and being able to learn from the monastics in Korea and to be able to interact in such a beautiful way with brothers and sisters in Korea. So I'm especially delighted right now to be participating in this conference organized by Dongguk University. Here you can see on the slide are images from around the world, and the one in the top left corner is from Korea. And in this case, Hyorim Sanim is giving a diploma to somebody who attended one of our courses. So the question is, first question is, what is self-compassion? So an informal definition of self-compassion is treating ourselves with the same kindness and understanding as we would treat a good friend when that person suffers, has failed, or is feeling inadequate. So in order to get a good sense of what is self-compassion, it's helpful to ask ourselves, how would I treat a friend when things go wrong in that person's life? And if you think about it, usually we're very sympathetic and we're patient and we're thoughtful and we're kind. And then how do I treat myself when things go wrong, when I fail, when I feel inadequate, when I suffer? How do I treat myself? Often we treat ourselves with self-criticism, and we're impatient and we blame ourselves. And so actually, you know, the saying goes, if we treated others the way we treat ourselves when things go wrong, we would have no friends. And the research shows actually that 68% of us, and this is pretty consistent around the world, are more compassionate toward others than toward ourselves. Only 6% of people tend to be more compassionate to themselves than others. Yeah? So that's an informal definition of self-compassion. A formal definition by Kristen Neff is a psychological resource with 3 components. The first is mindfulness, or knowing what we're experiencing while we're experiencing it, present moment awareness with acceptance. The second is common humanity, or a sense of I'm not alone. This is part of the human experience. And the third is self-kindness, a quality of warmth and care toward ourselves. The opposite of self-compassion is self-criticism versus self-kindness, a sense of isolation versus a sense of common humanity, and also rumination or self-absorption or over-identification instead of a kind of spacious, loving awareness when we suffer, fail, or feel inadequate. But this is only really half the picture, because most of the time when we think of self-compassion, we think of tenderness. But compassion can also be very strong, very fierce. So for example, if a building is burning and somebody runs into the building to save a person's life, that's very compassionate. But it's very active and it's very bold, right? So self-compassion has a tender part in which we are comforting, soothing, reassuring, and validating ourselves. But it also has a tough part. It has a yin side and it has a yang side. The yang side is to protect ourselves. If somebody's going to harm us, we need to say no, right? Or even if we're going to harm ourselves, we need to say no. But we also need to provide for ourselves, give ourselves what we need. The person in this life who knows best what we need and when we need it is ourselves. If we don't learn how to care for ourselves, we can never be happy in this life. So protecting, providing, and also motivating ourselves. Sometimes the most important thing we can do for ourselves is difficult. And so we need to motivate ourselves. Self-compassionate motivation is motivation with kindness and encouragement, not criticism. Self-criticism and criticizing ourselves to motivate ourselves is actually not very effective. When people hear about self-compassion, they usually feel uneasy at first, because when they hear self, they think of selfishness, or they think of separateness that causes all kinds of unnecessary suffering. And when they think of compassion, they think of weakness, like too soft. Actually, we know that self-compassion is the opposite. There are 4,000 studies on self-compassion, and they show, number one, that self-compassion is not selfish. Actually, people who are self-compassionate are more compassionate toward others. It's also not weak. People who are self-compassionate are much more resilient. They cope better with trauma, with illness, with all kinds of difficulties in life. They spring back when they have self-compassion, self-kindness, mindfulness, a sense of common humanity. Some people worry, self-compassion will make me lazy. Actually, self-compassion is motivating. People who are high in self-compassion are actually more motivated to reach their goals than those who are low in self-compassion, because they motivate themselves with kindness, just like a good coach, Some people fear self-compassion will make them self-indulgent. They'll just always be, thinking of short-term benefit. Actually, people who are high in self-compassion take very good care of themselves in the long term. They eat better, they exercise more, they go to the doctor when they need to. So self-compassion is a very good thing for us, even though when we hear the term, we might think, I don't know if I want to do that. 4,000 studies show self-compassion is one of the most fundamental resources that human beings have for mental health and well-being. So now I'd like to lead you very briefly in an exercise to give you a sense of what is self-compassion so that you can feel it. So this will just take maybe 5 or 10 minutes. So if you'd like to participate, please gently close your eyes. And I'd like you to think about a difficulty in your life, some problem you're having now. Maybe it's a health problem, maybe it's a relationship problem, maybe it's a work problem. And as you think about this problem, allow yourself to feel in your body any stress or discomfort that arises. As you think about the problem itself, If there are people involved, who's there, who says what to whom. Try to fully remind yourself of this problem and feel your body. And now the first part of self-compassion is mindfulness. So, can you notice where in your body you feel stress? Is it in your stomach, your chest, your throat? And just taking a moment to validate that this is so, like, oh, this is difficult. This is stressful. This hurts. And see if you can make some room in your body for this experience, just allowing it to be there. And why? Because what you're feeling is part of the human experience. So part 2 of self-compassion is common humanity. When you feel like this, you're not alone. Others also have feelings like this. In fact, many people in exactly the same situation would feel just like you do. Discomfort and stress is part of the human experience. This is a sign that you are a human being. So connecting with your humanity, knowing in this moment you are not alone. And then finally, if you like, you can put a hand over that part of your body where you are holding stress. And just feel the touch of your hand, maybe the warmth of your hand. And if you like, you can even gently massage that part of your body as an expression of kindness and respect for how your body has been working so hard to hold this stress for you. And now imagine that somebody were to whisper into your ear right now something that you need to hear. In fact, when you hear these words, you would feel so much better. Your heart would start to relax and rest. What are those words? What do you need to hear in a moment like this? Maybe, I love you, or I'm here for you, I believe in you, I trust you, you're a good person. What words, if you heard them, you would feel so much gratitude. You would say, oh, thank you, and your heart would rest. So if some words come to mind, allow them to roll through your mind. Allow yourself to soak them in, to notice how it feels to receive words of kindness like this. Okay, so this is part 3, that is self-kindness. Through soothing touch, through kind words. So now let's begin to release the practice, just allowing it to go. And just notice how you feel inside your body now. Allowing this experience to have been just as it was. And for this one moment, see if you can allow yourself to be right now just as you are. Just like this. fully human. And then when you're ready to slowly open your eyes, thank you for doing that practice that is known as the self-compassion break. It is the most popular practice for daily life found in the 8-week mindful self-compassion training. And it's based on the 3 components of self-compassion: mindfulness, common humanity, and self-kindness. And any time in your life when there's any stress or difficulty, you can practice the self-compassion break, or even just part of the self-compassion break, just a hand over the heart, perhaps, you know? At this point now, after 12 years, when I feel stress, I just 3 times, I tap my chest. And the first tap is, this is difficult. Second tap is part of the human experience. Third tap is self-kindness. So I do a whole self-compassion break in 3 taps. So thank you for doing that with me. So now I'd like to move into the field of psychotherapy. So self-compassion is actually not new in psychotherapy. It's been a part of psychotherapy for over a century. But it has been called self-acceptance. So self-compassion has been hiding under the umbrella of self-acceptance for well over 100 years. And many of the great old psychotherapists, such as Sigmund Freud and William James and Carl Rogers, all felt that self-acceptance was central to psychological well-being. What's interesting with acceptance is in scientific psychology in the 1990s, we started focusing on mindfulness in particular, which is acceptance of moment-to-moment experience. Like this thought, this feeling, can I make room for it? Can I accept it? Can I accept my anxiety? Can I accept my sadness? And this is a central part of psychology, particularly that we find in dialectical behavior therapy, acceptance and commitment therapy, and mindfulness-based cognitive therapy. So acceptance was acceptance of moment-to-moment experience. But now, with compassion-based therapy, we are also including acceptance of the self. Okay, so it started out as self-acceptance. Then we had acceptance of moment-to-moment experience. And now we have both. We have acceptance of moment-to-moment experience and acceptance of ourselves. And this has brought a new paradigm into psychotherapy. And that is mindfulness, acceptance, and compassion-based therapy. So in this big model, some therapists focus on mindfulness, in which they emphasize the role of attention and awareness in how we create and alleviate emotional suffering. Acceptance-based therapists focus on non-avoidance and acceptance of moment-to-moment experience. And though acceptance-based therapists are less likely to prescribe meditation than mindfulness-based clinicians. And then the third group, compassion-based therapies, primarily focus on emotion regulation through care and connection, rather than on regulating attention and awareness. So actually, self-compassion is the main treatment goal of compassion-based therapy. But these 3 therapies, mindfulness, acceptance, and compassion, they all belong together because they have similar philosophical background, which is that we actually all construct our experience day by day, and how we construct our experience creates suffering, and we can also then deconstruct our experience and suffer less. So one question that many people have is, what specifically is the relationship between mindfulness and self-compassion? So, as I was suggesting before, mindfulness is loving awareness of moment-to-moment experience. Self-compassion is loving awareness of the experiencer. Compassion always has a sentient being. There's actually a conscious being that is the object of compassion. And mindfulness asks, what am I experiencing in this moment? Compassion asks, what do I need? Or compassion for others, what does this person need? It's a slightly different question. And mindfulness we consider calming, whereas compassion is warming. And what's interesting is some people worry, oh, if I practice self-compassion, will I actually be strengthening the self? Well, what we find is that both mindfulness and compassion make the self more flexible, even makes it disappear. Mindfulness dismantles the self through attention to moment awareness, moment by moment, and the component parts of self. Compassion melts the self through warmth and kindness. Together, mindfulness and compassion are a powerful combination for regulating difficult emotions, especially in psychotherapy, where we find people bring their most difficult emotional challenges. So more about psychotherapy and self-compassion. Self-compassion appears to be an underlying change process in all psychotherapy. That is to say, it is transdiagnostic, which means it improves mental health in many different psychological conditions: anxiety, depression, substance abuse, personality disorders. And it's also trans-theoretical, which means it improves therapy in many different kinds of therapy. You could do mindfulness-based therapy, psychoanalytic therapy, cognitive behavior therapy. What we find is actually, no matter what kind of therapy, when people's symptoms improve, they are also growing in self-compassion. And this is easy to imagine. Just imagine that you are struggling with anxiety or depression. And imagine that during therapy, you become deeply self-compassionate. What this means is that when, say, you're suffering from anxiety, when you're anxious, you recognize and validate how you feel in that moment without getting lost in self-obsessive thoughts. You can say, oh, I'm feeling anxious. Oh, I can feel it here in my body. Oh, this is uncomfortable. And say it with acceptance. Imagine you're suffering with anxiety, and you can do that. That's mindfulness. Imagine you're suffering from anxiety, and in the midst of your anxiety, you don't feel like you're the only person suffering like this, but you think, oh, anxiety, this is part of the human condition. And I just happen to be feeling it now. Imagine that rather than feeling disconnected when you feel anxious, you actually feel connected to other human beings. What a relief, right? That's common humanity. And third part, imagine that when you're really anxious, your internal dialogue, the way you talk to yourself, is kind and comforting and soothing and reassuring, rather than self-critical and impatient. If you had this kind of internal dialogue, chances are you would not be anxious. So can you see how this works? And it works same with depression. It works same with so many difficulties. If we have mindfulness, common humanity, and self-kindness, the problem reduces. And the research shows this. The research shows that as symptoms decrease in psychotherapy, self-compassion increases. Now, there are actually many different ways of becoming more self-compassionate. Psychotherapy is just one way, you know. If you would like your clients to become more self-compassionate, ask them, what do you love? What do you need? How do you care for yourself? Encourage them to do that. And we find, the research shows, for example, that if you get a pet dog, you're more likely to become more self-compassionate. If you practice yoga, if you do forest bathing, if you walk in the woods and enjoy let yourself enjoy the woods, you will become more self-compassionate. If you practice only mindfulness without explicit self-compassion, you will become more self-compassionate. If you practice compassion for others, you will become more self-compassionate. And if you learn specifically to be compassionate with yourself, like in the mindful self-compassion training program, you will definitely become more self-compassionate, probably even more so. We've found that actually that self-compassion greatly increases when specifically learning how to be self-compassionate. So the next question many people have, many clinicians have, psychotherapists have, is how does self-compassion work? So the research shows that self-compassion is very closely related to emotion regulation. If, you know, these 4,000 studies on self-compassion, in one word, the results show self-compassion improves emotion regulation, which is the ability to regulate the intensity and the duration of emotional states. But how does it do that? Okay, so there are a few ways. Physiologically, self-compassion reduces fear. It reduces the body's response to dangerous and stressful situations. And it also, which is the sympathetic nervous system, and it also increases the parasympathetic nervous system activity, which is what allows the body to rest and relax. So it works by reducing fear. It also works by increasing a sense of safety. And it does this by increasing what we call heart rate variability. Very clear. When people have a moment of self-compassion, their heart rate variability increases, which is a kind of flexibility in the heart rhythm. It's a sign of safety, a sense of safeness and security. And lastly, self-compassion seems to work by increasing what we call executive function of emotion. So in the front part of the brain, when this part is activated, it tells other parts of the brain that get triggered by fear not to be so afraid when we don't need to be afraid. So we have more self-control from these prefrontal areas that regulate the fear response. So this is how it works physiologically and neurologically. Psychologically, self-compassion appears to increase what we call secure attachment. When children have been traumatized or neglected or had unstable childhood experience, they develop insecure attachment. That means with other human beings, they can't trust, but they also cannot trust themselves. But when we learn self-compassion, we learn to trust ourselves. And as a result, we learn to trust others. So this appears to be one of the ways that self-compassion also works. And finally, self-compassion works by reducing shame. Okay, so what is shame? Shame is an attack on the self. Guilt means I did something bad. Shame means I am bad. When we have feelings of worthlessness and inadequacy, this is shame, right? And the research shows very, very reliably that as self-compassion goes up, shame goes down. And shame is associated with just about every mental, psychological condition. That is to say, depression, anxiety, post-traumatic stress disorder, eating disorders, social anxiety disorder, like mine, public speaking anxiety is a social anxiety disorder. Behind it was shame, and all kinds of other problems, even chronic pain and narcissistic personality disorder. Shame is behind it all. And self-compassion reduces shame. And when it does, it reduces the psychological condition. Okay? Now, you may be wondering, how do I integrate self-compassion into psychotherapy? And there are really 3 ways. Okay, this is very important. The foundation is compassionate presence. This means, how do you relate to yourself as a psychotherapist? If you have a kind and spacious and understanding relationship with yourself, other people will feel it. So much of the human brain has been hardwired for feeling what other people are feeling. This is known as emotional resonance or attunement or interpersonal synchrony. It's a very natural thing. And therefore, when somebody's angry, we feel angry. When somebody is peaceful, we feel peaceful. And as a therapist, if we have tenderness and kindness toward ourselves, we are very likely to have a tender and kind presence, which others can feel. And when they are sharing their suffering with you, and your response is to sustain a tender presence, an open, loving presence, that person's trauma or difficulty will merge with the felt sense of you as a compassionate person and will alleviate their suffering. So your presence alone is therapeutic, way more than most people recognize. The second way of integrating self-compassion into psychotherapy is through the therapeutic relationship, which is how do we actually speak to or interact with our clients? And the research shows that basically the best way to teach self-compassion is to be compassionate. That is to say, for your words to carry the tone or the attitude of compassion. The research shows that empathy, or the ability to feel what other person is feeling with kindness, which is essentially compassion, is one of the most powerful and universal factors associated with positive psychotherapeutic outcome. That's compassion. In this way, compassion has been in therapy forever. We know that empathy works. And finally, compassionate interventions. That is to say, teaching things to our clients that they can do between sessions. So they're not only relying on seeing you once a week or every 2 weeks, an hour every 2 weeks. They can actually practice between sessions. They can cultivate their minds. They can cultivate their bodies and their hearts. They can learn meditation, or they can learn short meditations in daily life. So these are compassionate interventions. So as a therapist, you may wonder, how do I do that? Well, the key questions to ask yourself regarding your client is what does the client need? What does the client need to feel safe? What does the client need to comfort herself? What does the client need to physically soothe herself? What does the client need to validate herself? Maybe writing in a journal, maybe taking a bath when upset. Just today in psychotherapy, I had a client who said, I was with my family and they were all talking and I felt terribly excluded And I knew they would not accept me if I tried to push myself in the conversation. So I left the room. I watched a very nice television show that I enjoy. And after an hour, I came out and I talked to them quite happily instead of feeling bad about myself for a whole hour. This is television for self-compassion. So there are thousands of different ways that people can be self-compassionate. But the most important thing is the intention, the wish to be kind to oneself. Another question you can ask if you would like to help your client to be more self-compassionate is, how do you care for yourself already? Or if you had a friend, this is an amazing question. If you had a friend who felt exactly like you and was in exactly the same situation as you, how would you treat your friend right now? Can you treat yourself in the same way? That's the essential self-compassion question based on the informal definition of self-compassion. Treating ourselves with the same kindness and understanding as we would treat a good friend. Oftentimes, patients, clients who feel they don't deserve self-compassion and can't even imagine how to be compassionate with themselves are very compassionate toward others. Ask them, how do you treat others? How do you treat a friend? Can you begin to do that for yourself? Or maybe a little bit of that for yourself. It's amazing because it's just what we call a U-turn. Our compassion is usually flowing out. We have the energy of compassion, but we can also return it to ourselves. So those are some tips. I would like to say that the Center for Mindful Self-Compassion in the United States has a 30-week certificate program in self-compassion-based psychotherapy. And this goes on once a year. If anybody's interested in doing that, unfortunately, it's only in English, but there will be there are new courses starting each fall. So if you want to dive deeply into self-compassion-based psychotherapy, please go to that website, centerformsc.org, and you can learn more about it there. And finally, I would like to share that self-compassion is not only good for our clients, it's also very good for ourselves. In particular, and we've seen this especially during the pandemic, that people who are working directly with patients, either as physicians or as counselors, psychologists, maybe monastics, maybe educators, people who are working directly with other people who are struggling also feel that pain. Do you remember when I said the human brain is hardwired to feel what other people are feeling? When other people are suffering, we feel it as our own. And at some point, it can become too much. And that's what's called compassion fatigue. Actually, it's really empathy fatigue, which means compassion is feeling another person's pain with love. So one thing we know is that it's very difficult when we've been overwhelmed through caregiving to try to bring in more love and kindness, because we think we have to bring more love and kindness for the other person. But this is the amazing thing. Self-compassion is a wonderful antidote to caregiver fatigue. When we are suffering from too much caring for others, the natural response, which we do not usually do, is to balance it out by caring for ourselves, even just a little. And so now I would like to close with a little exercise. It's called Giving and Receiving Compassion, which you can practice even while doing psychotherapy, or while caring for your child, or while interacting in some way with somebody who is suffering. okay? It is called giving and receiving compassion. It will take maybe 5 or 10 minutes, and that will then close this talk. I will lead it now as a meditation. And in fact, you can practice it as a meditation, but it is most powerful if you practice while caregiving as an antidote to compassion fatigue. And I'll tell you before we do it, the secret. And the secret is we will be connecting with our breathing, and we will allow the in-breath to be for me and the out-breath to be for you. And since we are constantly breathing, if we just remind ourselves that the in-breath is for me, then we actually begin to bring a little awareness of our own suffering. And sometimes we even bring a little kindness toward ourselves while we're suffering. And that often creates a little space, a little distance that allows for us to feel some freedom and allows something new into the relationship. And that would be compassion. Okay, so we will practice giving and receiving compassion using the breath. Again, 5 or 10 minutes. You've been listening very patiently and graciously for almost 1 hour now. I would like to invite you to find a comfortable position and allow your eyes to close partially or fully. And just notice whatever sensations might be in your body at this time. And in the midst of all those internal sensations, noticing if you can find your breathing. In particular, if you can notice your body breathing in and your body breathing out. And now I would like you to bring to mind a person in your life whom you are caring for, who might be frustrating you, who might be exhausting you. Maybe you're even starting to feel some anger or resentment toward this person, even though you are supposed to be caring for them. That's a sign of compassion fatigue. And if you can't think of anybody in that category, then maybe you can just think of someone who's suffering that is causing you some stress. It could be people suffering in a war zone. It could be people you hear about on television who have hunger. So any kind of empathic pain. But for this exercise, it's best if it's somebody in your life, in your immediate life. And as you think about this person or these people, noticing how it impacts your body. See if you, again, can feel any tension in your body as you think about this relationship. Any uneasiness, any discomfort. And now reconnect with your breathing, feeling your body breathe in and feeling your body breathe out. And just for now, focusing on your in-breath, one breath after another. Noticing how your body is being nourished, strengthened with every in-breath, nourished with oxygen with every in-breath. And if you like, even inhaling some compassion for yourself, some kindness, some warmth, some light. Even the word compassion, karuna. One in-breath after another. Letting each in-breath be for you. And now thinking about this other person or persons, someone who might be exhausting you, someone who is causing you stress. Thinking about this person, please bring your attention now to your out-breath, to exhalation. And just feel the sense of ease and relaxation in your body as you breathe out. And with every out-breath, sending ease and well-being to this other person or persons. Focusing on your out-breath, one out-breath after another, and sending ease and well-being to another. Maybe even sending compassion with every out-breath. Compassion. Kindness. And now linking both the in-breath and the out-breath with yourself and this other being. Allowing every in-breath to be for you, one after another, and when you feel ready, breathing an out-breath for the other one. Maybe one in-breath for me, one out-breath for you. Maybe two in-breaths for me, one out-breath for you. Maybe 10 in-breaths for me, one out-breath for you. But please, making very sure that you are nourishing yourself with kindness and compassion. And when your cup is full, when you are ready, sending kindness and compassion to the other one with your out-breath. Finding just the right balance for you. Okay, now beginning to release this practice, keeping your eyes closed for a few more moments. Allowing this practice to have been exactly as it was. giving yourself permission to breathe in as often as you need before you focus on the other person and breathe out for them. That's not selfish. That is good for the relationship. And before you open your eyes, perhaps formulating the intention that if you ever feel stress or uneasiness in a caregiving relationship, that all you need to do is to connect with your breathing, remembering the in-breath is for me. Feeling your body breathe in for yourself as often as you need. And then when you're ready with the out-breath, sending ease and compassion to the other. And now entirely releasing the practice. And when you're ready, slowly opening your eyes. So that practice is called giving and receiving compassion. Some people call it in for me and out for you. Some people call it one for me and one for you. But the most important thing in this practice is to allow the in-breath to be for yourself as often as you need. And you will find that your ability to care for others actually improves when you are kind to yourself. So that concludes this talk on mindful self-compassion in psychotherapy. I thank you so much for your attention. I thank you for your practice, and I wish you health, happiness, and all joy in your work and in your life. Thank you so much.